Roscoe has a tumour go under the radar for such a long time. Morning. Oh, here he is. So it is 7 a.m. and we have just got up. And this is not how we would want to spend the morning, is it, Roscoe?
He's not looking at the camera because he knows what today is. So I've told a little white fib and I've said,
treats.
Roscoe's waiting for his treats. He's waiting for his treats. But he has 1 tablet, 2 tablet, 3 tablets,
and
4 tablets.
And we have to give it to him 2 hours before the operation, which is why we look like this.
A little bit of cheese, and then we very secretly hide tablet number 1. It's a treat.
Oh, please eat it all. Oh god, he's not done that.
Yes. Oh my god, that's 1 down.
3 more to go. Good boy. And then the reason why we have to give him these tablets is 1, he just really hates the fats. So it's like to help calm him down. But 2, because it's like a big operation.
Oh my god.
Oh god, if he didn't do it, he literally didn't eat the tablet. Oh my gosh. You didn't eat the tablet? I don't know why you're coming to the camera for, Roscoe.
I don't know what you're laughing for, Roscoe.
You said,
Oh, for goodness sake.
tablet.
So we're a little bit nervous today. I've actually got really bad butterflies in my stomach.
We're really sure if we're going to make this video, but then we wanted to make this video basically to bring awareness. So Roscoe has a tumour and cancer, and we found basically a few months ago we found this like little lump on his side, and we went to vets and they were like, oh, it's just like a cyst, or it's just like an old like fatty lump.
Because he's now getting to 9 years old.
And we forget that sometimes because he is like, he still looks very youthful.
Even though he looks like an old man now that we've given him his meds.
We kind of like listened to the vets for a while, and then like Matthew's gut more than mine was like, no, I feel like we should just get it like checked
with a biopsy out. Because I think the main thing was with the lump was because it was like getting big and small.
But it wasn't hurting him.
Yeah, it wasn't hurting him. Like you could literally like move it and everything.
Yeah.
We were like, yeah, it must be a cyst, and the vet was like, it's the cyst.
Yeah, so we had that for like a whole like, I would say like a month.
I'd say longer. It was quite a few months. Yeah.
We just noticed it got really big, and we're like, no, we're gonna go in and we want like it checked. So we went in and got it actually checked, and we had to really push for like a biopsy and like for them to take like a cell to send it off to kind of get the results. Whilst we were in Japan, we got the results back, and it actually came back as a grade 1 tumour, which basically means skin cancer.
It's called a cell mast tumor, which is like a form of skin cancer in dogs. But it's definitely worth, if you ever find a lump on your dog
or yourself,
get
it checked.
Always get it checked, because we were so close to just leaving this lump and being like, oh, it's just like something that, because our vet was like, oh, it's just something that he'll like live with. You can get rid of it if you want. But
it's more like cosmetic. And what's really annoying is like you believe the vets, and the vets were so like, it's just like a cyst, it's just a cyst, it's fine. But I feel like if your gut is telling you to get it checked, like push to get like lumps and spots checked, because I literally dread to think,
like, God, no, it would have spread.
Now we like take him to their, they get it, they do their margins, and they kind of take the lump off and remove the lump, but then they send that off, and then we kind of have to wait and find out if it's
spread, or if it's something that he'll need like ongoing treatment for, or chemotherapy, that sort of thing, because dogs have that.
But we just wanted to make this video, so if you have a dog and they have a lump, or you have a lump, please, and if someone said like, oh, it's just like a spot, then if you just keep an eye on it and then actually push to get it checked. I feel like it's just worth getting it actually checked, like with like biopsies, MRI scans. So that's kind of our day.
So now we're gonna head to the vet and we're gonna go and drop him off, which is the bit that I'm literally dreading.
He hates the vets.
Right, we're ready. You've been having a little wobble.
I just don't like, it's just, I feel like really, I don't know, I don't like it.
It's fine. He'll be fine.
I know. I think like I just hate the feeling of him being in pain, and also because I know he hates the vets. So we're leaving him, and he doesn't understand.
I do feel bad that we have to leave him.
He doesn't understand like why we're leaving him. It's not because we're like cruel parents. But in the end, it obviously has to get it done.
Ready?
Yeah.
You ready?
You just don't understand.
You ready to go?
Oh.
Oh my God! Come smile at least.
It looks like how I feel.
I can't cope with that. Okay, we've made it to the vet in one piece, haven't we, Roscoe? He's just like, I love the sun, Daddy. We have had to call them because we can't just take Roscoe in because he starts panicking as soon as he smells the smell of a vet.
So we literally just need to work out logistically. They're going to let us know and we'll run in with him and basically drop him off.
You like run, drop and dash, give him a kiss and just say to the vets,
Just hope for the best.
hi. Oh my God, this is so bad. Like the drive here, we didn't talk. We were just like in silence, just like...
I think it's because it's like happening. It's like it's such a big thing, and I always take for granted Roscoe being older because I feel like I look at him and I'm always like, oh, he's still a puppy. He's very young-minded, so I forget that actually he is turned into a little bit of an old man. And I feel like now it's like hit me like, oh, he is getting older.
So fingers crossed. We're just keeping everything crossed.
I
Right
just
now.
hope it's all fine.
Oh God, I feel sick. I feel so bad that we've left him.
I feel like really bad parents. She was really nice. The vet lady was really, really nice.
And she did make us feel better about it being misdiagnosed before because she said
it's a thing.
a mast cell tumour, they call it the mast cell tumour.
Because people sometimes, you don't really know what it is. It can go under the radar for such a long time. She explained the whole surgery with us, and basically they talk about margins, which is kind of like, I'm going to say like how many like inches they're going to take from the like lump. And it did make me need to burst into tears because they're going to, I think she was like, it might shock you how much more they would take, even though mentally I feel like I'm trying to prepare myself.
Because they said on a normal lump they take just a tiny bit of skin, but with a mast cell tumour,
Because it can spread.
She said there's lots of like little satellite cells around it, and they have to try and take as much as possible to make sure that they physically get all of it out of his body. He's having blood tests, he's having his nails cut, he's having his ears cleaned.
It's going to come out on you, Doc.
Yeah, so we were like, do everything while he's asleep.
But he was really chilled. I found the medication really helped this morning.
And do you want to say what they said to us as we left?
Oh, he's like, he's shredding his like what do you call it, like
the dog
gown.
bed.
Yeah, he's shredding his dog bed. Does he like just shred it or does he eat it? I'm like, he just shreds it. It's something that Matthew's dad taught him at Christmas.
But he's not really a shredder though, is he? So I'm surprised.
He loves shredding.
No, but he is. But you wouldn't think that he would be in a new situation and go.
Not when he's like had all these sleeping tablets. But any kind of Christmas paper he would just shred.
But if he came to like your house, for example, he wouldn't sit on your sofa and shred your sofa. It would only be if you were unwrapping a present, because he now thinks that that's a time for him to shred things.
He thinks he's allowed to do that because of Matthew's dad.
So we've come into Pets at Home to get him some treats because he's a brave boy.
He actually needs a new collar as well because he can't wear his harness. That's where
it rubs on the tumour. But there is one thing that I've just seen that I feel like we need to get, and that is a Toy Story harness.
Oh, that is so cute.
Why are they so cute? Oh my God, look at the little bow. We could get him a little bow to be like, I was a brave boy.
I think he'd prefer like an actual food treat.
I was a brave boy in my surgery. What about a little like woody collar? Because we're not going to...
How much?
Okay, it's £12.
We're just going to get him a cheap collar.
Yeah, maybe just the cheaper ones.
Yeah, because he's not supposed to have them, I see.
And because Roscoe's got like the flat face, he can't really have collars because it like stops him breathing. Would you like to show you what collar we did get?
The cheapest one.
We've gone cheap and cheerful with spring daisies to put the spring back in his step. And then we're thinking we're not going to do toys because if he plays with them, he's probably going to rip out his stitches.
So we're trying to get him like a bone or something that he can just sit quietly and like chew on.
He does
really like these.
Love these, but they are
so expensive
and so small. But they're rawhide free, so we're going to try and get something that's good for the dog. And I love the new Pets at Home signs on each aisle. It's like they knew Roscoe was going to be coming.
That is the Roscoe thing.
Got a bag of dog food. I almost forgot this and would have been so angry tonight. And these are all the toys we wish we could get him. I'm just going to say one thing.
We got these and it's supposed to be rough and tough, and it's supposed to be like for big dogs that like rip apart. And
he destroys them in an hour.
He just gams on it, doesn't he? And it just starts like pulling it.
So don't be fooled that these are tougher toys because they're really not. Do you not think we should maybe just like...
Look, he'll just whip out his stitches.
Go on, darling, you explain what's happened.
So it is now 5 p.m. We've got the call. It's been a few hours. We're going to pick up Roscoe. They did call us earlier just to say... Why are you getting so close to me? They called earlier just to say that it looks worse than what it is.
We're like, what on earth does that mean?
Who wants to hear those words come out of a vet's mouth? So it looks worse than what it is. Apparently they had to take extra like, what do they say?
Extra skin basically off, and then they've made all these incisions around it so his skin stretches. And I was just like, whatever you recommend. Like, try not to faint over the phone.
I just feel like, what have you done to my poor dog?
But you know, where you're just like, we just want to see our baby.
Yeah.
So we're going to go in now and we're going to go and get him. Oh, he's got a little foot bandage and everything.
We're back home and Roscoe, you were a very brave boy.
He just looks like he's been like through a fight. He's got a
He's
bandage
more
here.
Yeah.
He's got a big bandage here. He's got a bandage underneath.
This is where the tumour was on this side.
And then he's had a little fatty lump taken out near his nipple, and I think they've taken away his nipple too. And then they put a IV drip in here.
There's another little gash this side of him, and then there's a little gash this side of his. You kind of see it there, and it's just really sad.
But
I didn't expect him to be so like
battered and bruised.
Yeah.
But I feel like it's a good thing because he is now had everything
yeah.
quickly taken off, and now it's just recovery and treats and dinner. And just like that, he's eating his food. I mean, I think it's a good sign that he's got his appetite, to be honest.
He will never lose his appetite.
Because if he was in like loads of pain and was like hating life, he wouldn't be eating. So we'll find out tomorrow. Actually, he's got so much medication that even if he is in pain tomorrow, he won't be in pain.
We had to actually get them to write it down because we were like, what?
He's got about 5 different pills and syringes and all this stuff, but I think
it makes me feel happy he's eating though.
Yeah. So it is a little bit later. We are just all about to head to bed, and we've taken Roscoe's. Did you just fart? Did you just do a little farty McFart? But we thought we'd just show now we've taken off what his bandages look like. So he's got it. God, Roscoe, your bum stinks. But he's got, oh my God, you can kind of see where they've shaved, but he's got this completely covered. He's got like his nipple covered where they've taken that off too. So I feel like he's really been through it today. Haven't you, Roscoe? Hey? Were you a big brave boy? Oh, Daddy's coming. We weren't sure whether to have him downstairs tonight, but we do have like a spare crate.
I feel like we're gonna put him with us just in case he starts like licking at the wounds, and then hopefully I'll wake us up and just be like, you can't do that. Once he's downstairs with his licking, we literally
wouldn't know, would I? Hey, I wouldn't know.
Don't hype him up. This has turned into a little bit of a lucky day, Roscoe, because we're gonna have a sleepover.
Thank God we never chucked this away when we got the other crate.
So we're gonna have Roscoe sleep in our bedroom tonight. Normally, if he sleeps in our bedroom, he'll just like sleep on our bed with us. But I feel like we're just a bit worried that like if we just jump in on off the bed is a big no-no, isn't it? But also just in case one of us accidentally touched you and it hurts. So before, if you're in your cage, you're nice and safe.
Did you put him in there?
I just popped him there, yeah.
He looks so not a vibe. Should we pop him in?
I think it's time to go to bed, guys. It's been a long day. Go on then, in your bed.
Good boy.
Good boy. This cage we've had for absolute years. We've had this cage since he was basically a puppy in the flat. Right, close him in.
Good boy.
Good night.
We have just woken up. It is the next day. Oh my goodness.
You slept well.
I slept well. Look at my hair. Did you sleep well? Come on then. Good morning. I've got a feeling that he's really thirsty because in the night I could hear little bits of.
I feel like he was coughing that medication.
Good boy. I just got some licks. We're going to go let him out and see if he needs a little wee. A wee and a drink.
Yes, please.
It's 2 days post-surgery and we're going back for our
check-up, vet appointment, check on the little scars. How are you doing?
Are you feeling better? Well, the ears are up, so you're feeling much better.
It has been a long 2 days, not gonna lie.
He has just been in his crate.
Sleeping,
or on our lap.
Giving us the evils.
So we're going to go and hopefully get some bandages taken off, eh? And then you can have lots of treats. Someone was so brave. He was a brave boy. And now he's just having a little rest. We're back. Oh, is that a little stretch? Oh, such a good boy. Such a good boy. So Roscoe's appointment went so well, thankfully.
Thankfully, the stitches are stitching back together. Healing.
They're stitching.
They're healing. There's no infections, no issues. He just needs to be like basically what he is now, the next 4 days. And then we go in for one last checkup, see if the stitch is all healed, and fingers crossed we get the results in about 5 days' time. We're really hoping that the tumour's gone and there's no remains of cancer. So it is a few days later. We've come back from the vet to get Roscoe all checked out, and the results have come back. We initially said it was a stage 1 mast cell tumour,
but it turns out that it's actually a stage 2, but still a low grade stage 2.
Yes, it's low grade, but still more than what we thought. So they are now sending the results off again for further testing.
Yeah.
To see if it's spreaded, and then we just go from there, basically.
Which we're just like, what? It was really weird because we were driving there and I hadn't meant to prepare for anything bad.
It's weird because he had 3 little, it was his, mast cell tumour, but there was 2 little lumps. So she started with the 2 little lumps, and they're, harmless. That's great. And then my gut was like, there's a but. There is literally a but. I think I literally looked at you and was like, oh, God, here we go. And then it happened. I was like, oh.
But she's still positive, and I feel like I'm still positive because she said that it's low grade.
I just want to know. So, we just sit and wait. We will keep you guys updated in our next video. We'll mention it, and obviously if you follow us on Instagram and all the other platforms, we will let everyone know when we know. But we find out next week.
But if you take anything from this video, just please, any lumps and bumps on you or your dog, any
animal, just get it tested straight away. It's just so worth it. And all good vibes. It will be fine. He's not in pain, so it will be fine. It's just like, you know, you just want to know. But any lumps or bumps, go to the doctor, go to the vet, get them checked. Yeah, we love you guys, and we'll be back soon.
See you in the next video, and we'll keep you updated on Roscoe's lumps.
Bye, everybody.